Good morning.
Can you make me a co-host, semi-co-host?
I just added you.
Thank you. And I can let people in when you're ready.
Perfect. Let me switch to share screen mode. Okay. Can you see my slide deck?
Yes, it's like yeah, now you're in presentation mode.
Perfect. All right, ready when you are.
Awesome. Okay, I'll let everyone in.
Good morning, everybody. We'll get started with our May edition of the Vitalyst 101 webinar in just a moment as we let folks into the waiting room. Thanks for joining us this morning. Welcome, everybody. Thanks for joining us. We'll get started in just a moment. While we're letting folks in from the waiting room, feel free to introduce yourself in the chat room, your name, your organization, where you're zooming in from on this Friday before a 3-day Memorial Day weekend. Thanks for joining us. Great. Thank you so much for joining us. We'll go ahead and get started as we continue to let folks in from the waiting room. Thank you so much for joining us on the Friday before a 3-day weekend. Hopefully, this is early enough in the day that you're still able to get out a little bit early and enjoy the beautiful Arizona sunshine. My name is David Martinez, director at Vitalyst Health Foundation. I'm joined by my colleague Erica Foster, who is managing the Zoom room and letting folks in from the waiting room. She'll also be tracking the chat as we progress for this hour-long conversation. This is a monthly webinar that we host to introduce folks to Vitalyst Health Foundation. If you're not yet aware of how we operate as a foundation here in the great state of Arizona, I have the great pleasure of directing our grants program as well as our civic health portfolio that you'll learn a little bit more about today, and love just hosting these and being in community with you all. To get us started, we have a couple of housekeeping notes. So if you have any accessibility needs, including in Espanol, you can email conversemos@vitalysthealth.org. We have the closed captioning option available. Just utilize that service via the Zoom links there. Everyone should be muted as we go into this webinar, so keep yourself muted as I present, but we will be opening up the lines, if you will, for a live Q&A at the end. But please definitely put your your questions in the chat room, and as she's able, my colleague Erica will be answering those throughout the session, but we will be reading those aloud for the recording and to answer any of those that she can't cover. We are recording this webinar. The recording, the slides, and additional materials will be posted to our vitalysthealth.org Partnering with Vitalyst webpage, as well as emailed to all the folks who registered for this webinar. So get us started. Vitalyst is on we have a vision that all individuals and communities in Arizona are healthy and resilient. We do that and are on a mission to advance that vision by seeking to connect, to support, and inform efforts that improve the health of individuals and communities throughout the great state of Arizona. While Vitalyst is based in Phoenix, we have partnerships throughout the state of Arizona. While we are a health foundation, we see health as more than just health care. We look at the broader social determinants of health, or what we call the elements of a healthy community. A lot of folks might be familiar with the will, as we affectionately call it, that reflects the different elements of a healthy community. As you'll see there, there's a spoke on the wheel noting access to care. As I mentioned, healthcare is very important to living a healthy, productive life. But we see health as more than just healthcare. We look at all aspects of the spokes on this wheel. So this is a great kind of question as you're exploring if there is fit for your organization, for your efforts with Vitalyst. This is a great framing of mission alignment. So if you see yourself in this wheel, it will likely be mission alignment. Even if you don't see your specific field or sector or subsector within the larger nonprofit sector reflected in one of these spokes, you likely still are. If you visit vitalisthealth.org, we have a whole webpage dedicated to the will, and it's very interactive so that you can click on things like transportation options and see the various types of multimodal transportation options that can be included as part of that specific spoke and the health implications for those areas. So take a deeper dive on the will. We also have worked with community partners to have this will translated into Spanish and also worked with tribal partners to create a new will actually in collaboration with the tribal communities throughout Arizona to create a will that is reflective of an element of a healthy tribal community, very centered and reflective of the unique needs in Indian land throughout Arizona. So check those resources out. A great initial test to see if your effort is aligned with Vitalyst in the first place. Vitalyst has a lot of work, as you'll see, but we really focus our efforts around three goals. So we advance the vision and mission of Vitalyst by supporting collaborative networks that are working to improve the conditions that impact health. This is a really key aspect of our efforts at Vitalyst because we do work in what we frame as an upstream mechanism to improve health rather than a downstream mechanism or with downstream interventions or solutions. I used to work in food banking, so I often give this example. Very rarely will you see Vitalyst support downstream interventions of alleviating hunger, for instance, through food bank support. Very important role that Arizona food banks and food banks across the country and globe conduct because we know that too many of our neighbors are experiencing hunger today and they need the great services that the food banks provide through emergency food box distribution, et cetera. But those are downstream interventions. We want to look upstream and ask, why are people going to the food bank in the first place? What is wrong or what barriers are set up that is impacting the food system and a person's ability to access fresh, local, healthy foods in the first place? So really looking at a food system approach. That systemic approach is heavy. It takes a lot of work. It takes a village, which is why we have a whole goal area specifically focused on supporting collaborative networks. And you'll see that reflected throughout our priority areas that you'll learn a little bit about in just a moment, as well as our grant programming that I'll take a deeper dive into as well. Still, we recognize that those collaborative networks are made up of individual community organizations. So we do work to strengthen community partners, really ensuring that they're equipped to advance health equity. You'll see equity and frame a lens reflected in many aspects of our work because it's a value that we hold at Vitalyst and try to inspire other folks to hold as well. So we have a whole goal area to strengthen community partners, and you'll see those activities reflected across our efforts as well. That upstream approach to improving health often involves policy and advocacy, which is why we have a specific goal area around informing decision makers, especially to prioritize community health and well-being. So We ourselves, as a nonprofit, leverage Vitalyst's voice in public policy and advocacy efforts, but we also frame our work and support of partners to inform decision makers as well, which is an aspect of our efforts in throughout our programmatic priorities, but also in our grant making. So I like to say that Vitalyst has three sides of our house. We have our programmatic priorities reflected here, so I'll take a deeper dive in just a little bit. We have our grant making side of the house, which will be in a few slides later. And then we have a fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ, which is an entity that can serve as a back office finance and accounting for entities throughout Arizona. There are different types of fiscal sponsorship we have, so folks can come under the 501(c)(3) status of Vitalyst and TAP-AZ if you don't want to go through that laborious process. Or even if you are a 501(c)(3) registered nonprofit, you can essentially outsource your back office finance and accounting needs, your bookkeeping, to Vitalyst and TAP-AZ as a fiscal agent or for grant-specific reasons. I won't take a further deep dive into TAP-AZ and fiscal sponsorship, mostly because they host a very similar monthly webinar for TAP-AZ, kind of a TAP-AZ 101, if you will. So if you're interested in exploring and learning more about fiscal sponsorship, check out tapaz.org. They have a similar monthly webinar where you can learn more about fiscal sponsorship, all the great services that the TAP-AZ team provide, and to explore that option for you, especially if you don't have the capacity for that back office finance and accounting, and you really want to focus on your mission and your programmatic area. So tapaz.org. Coming back to the Vitalyst side of the house, as I mentioned, we have our grant making and our programmatic priorities. So in this slide, you see the three programmatic priority areas that we focus on. These are areas that the Vitalyst team have deep and extensive experience in, and that are priorities that we've identified that are really critical to improving the health of Arizonans. So every year we have a discussion about what those priorities should be. We don't see too much of a swing from year to year. We really do try to have consistent strategic efforts over the longer term, and these are the three that we really have dug into. I'll start with healthcare integration, which is a portfolio area that my colleague Anna Rossetti oversees, and then I'll take a deeper dive into housing and civic health. So you'll see this reflected at a very high level on this slide. So our healthcare integration portfolio really is about how the physical, the mental, and the social determinants of health are all integrated, and how it's really important to improving your life. And you'll see my wonderful colleague there, Anna Rossetti, who oversees that portfolio. So Anna works with community partners in the healthcare integration field to outline a set of strategies connected with our three goals, you might remember: collaborative networks, strong community partners, and informing decision makers. So in the healthcare portfolio that Anna oversees, she prioritizes specific activities and strategies to help integrate the physical, mental, and the social determinants of health. Of course, if you've turned on the news lately, you know that the federal government passed what's known as HR 1, a now law of the land that is cutting Medicaid and SNAP services, among a lot of other things that are impacting us here in Arizona. You might have seen about 400,000 Arizonans have now been disenrolled in SNAP, or the food stamp program, which our food bank networks are now organizing, and the Arizona Food Bank Network is engaging on. Also, we're working diligently, Anna, especially with our healthcare partners, especially community health centers, community health workers, to mitigate the impacts of the pending Medicaid cuts. Medicaid is the federal insurance program administered here in Arizona through Access and Kids Care for Kids, for children, to ensure that they have health insurance if they qualify through income eligibility. So with those pending cuts, Anna has been working through the collaborative network, remember that goal, the Cover Arizona Coalition to help Arizonans navigate that healthcare system. It was created actually when the Affordable Care Act passed and Medicaid was expanded in many states, including here in Arizona. Now that coalition continues to convene and help folks navigate if they do fall out of eligibility through access or kids care for their kids. Um, Anna also works on a lot of other critical healthcare areas, public health issues emerging and existing throughout the state, especially areas of health that show the greatest disparities in health throughout our state, including maternal and child health. So working to strengthen community partners, again, goal number two there in those specific areas. Anna also oversees the overall advocacy and public policy for Vitalyst, which is our goal three, informing decision makers, but also leverages Vitalyst support with regards to other issues impacting Arizona's health, like access, like maternal and child health, and other critical public health measures. Next to her right, is my colleague Gabriel Jaramillo, who oversees our housing portfolio. Gabe has a lot of experience and community service in the housing space and brings a wealth of that to Vitalyst and has outlined strategies, again, connected with the three goals of Vitalyst. So supporting the collaborative network, the Arizona Housing Coalition, which convenes the entire spectrum of housing from homelessness or houselessness to housing affordability and everything in between to try to come up with solutions and investments, advocate for investments for things like the Housing Trust Fund. And he also works to strengthen community partners that are especially showcasing promising practices to encourage especially workforce affordable housing. So he's created toolkits with community partners leveraging his own expertise and expertise of housing folks throughout Arizona to encourage what we call anchor institutions to leverage their vacant property, vacant land to build affordable workforce housing, especially connecting them with nonprofit housing developers that can leverage the land that we often see at schools, colleges, churches, community health centers, in various areas and connect those entities with nonprofit affordable housing developers to build affordable housing that is needed throughout the state. We've seen great partnerships happen already in cities like Flagstaff, up in Pinetop Lakeside, down in Tucson near Vail. So it's really awesome work that he's leading to help address the housing crisis throughout Arizona. The fellow next to him is our colleague Sergio Perez, who directs the communications at Vitalyst Health Foundation. So he helps tell the story of Vitalyst and our amazing community partners. But he also has expertise in education and in the food systems in prior roles that he has. So as folks reach out to Vitalyst, and you'll learn more about how to do that, and you're working in those spaces, you'll be connected with Sergio to explore what our partnership could look like. Those efforts aren't key priorities of Vitalyst, but we look at the broader, again, social determinants of health so that will and can facilitate those conversations. And then the guy on the left, that's my mug. I direct our civic health portfolio, which is really about supporting how Arizonans are coming together every day to tackle their toughest challenges. And as a health foundation, how those folks are working to improve the health of themselves, their families, their community. We think that effort strengthens our states and leads up to strengthen our American democracy. So the civic health portfolio focuses on supporting collaborative networks that are working to do that, especially a coalition called One Arizona, which is a table of about 30 grassroots community-based organizations that are building relationships throughout the state and engaging those communities and empowering them to let their voice be heard in our communities and in our government. We also are working to strengthen community partners through an organization called Instituto that offers capacity building support for those movement leaders and community organizations, a really strong effort to help bolster those civic health partners. And then we also leverage our voice and the voices of our partners to inform decision makers about critical voting policies, especially going into an election year. There are efforts that would restrict an Arizonan's ability to register and cast their vote, including voting early and voting by mail, if that is a mechanism which you choose to vote. So we are engaging in policy and in items that may end up on the November ballot. Very busy election year for us. So those are our programmatic priority areas of Vitalyst. We often leverage non-competitive grants for those that align with the strategies that Anna, Gabe, and I direct as part of the portfolios that we oversee in collaboration with community partners. But we also leverage we leverage our expertise beyond that programmatic grant funding. We do a lot of research, a lot of convening, communications, and again, as I mentioned, advocacy and public policy in this spaces. So that's areas that we focus on through our programmatic priority areas. If you're like, I don't work in those three areas, does that mean I can't partner with Vitalyst? That does there are still a partnership opportunity through our grant making program that I'll talk about in just a little bit. And that little bit is now. So our grant program at Vitalyst Health Foundation is an overall a 5-year grant potential of nearly $225,000. That 5-year grant potential is broken up into 3 different grant types. The first grant we have is a technical assistance grant, followed by a Spark grant, and then the systems change grant. So these are 3 different grants that in total add up to 5 years and a grant potential of $225,000. So this is we covered the programmatic side, programmatic priority side of the Vitalyst House. This is now moving over to the grant making side of the house that I get to direct in addition to the civic health portfolio. So now let's take a deeper dive into each of these 3 grant types. But before I do that, I mentioned that as you reach out to Vitalyst to discover partnership, whether it be through our programmatic priority areas that I just reviewed or through this grants program, we have set up a process called our discovery intake process to discover partnership. So if you visit vitalysthealth.org, and as you're listening to this webinar and seeing alignment with our mission, with that wheel, seeing yourself in the wheel, the elements of a healthy community wheel, and for a particular grant type, you would go to vitalysthealth.org, complete that discovery intake form on the webpage, and we receive that, review it, and if there is alignment, you'll be prompted to schedule a time to chat with one of the Vitalyst directors that you just saw in the previous slide. And the Vitalyst director that you talk with depends on what your effort is tackling, what issue area or sector or subsector that you're working in. So for instance, if you're in the housing space, you would talk with my colleague Gabriel, who oversees our housing portfolio. If you are working in some aspects of healthcare or in a public health issue, you would talk to my colleague Anna. And then if, again, working in areas of like food systems or the educational system, you would talk to Sergio. Certainly, if we're working on anything civic health related or any other aspects, I'm a bit more of a generalist. You'll have the lucky opportunity to chat with me. But you first go through that vitalysthealth.org website, complete the discovery intake form. So as you're going through this webinar and you're like, yes, there's so many connections, I'm definitely aligned. What do I do from now? Go to vitalysthealth.org, complete that discovery intake form, and that'll begin the process for us to have a conversation to explore that partnership. So what are those partnerships? As I mentioned, we have 3 grant types at Vitalyst Health Foundation as part of our overall grants program. The first tier of our grants program is called the Technical Assistance Grants. This is to support collaborative capacity building because, as I mentioned, we work in that upstream way to try to tackle the root causes of the greatest health disparities in Arizona. It's heavy work. It takes a village. It takes a collaborative. Again, connecting back to our goal area number one, right? Collaborative networks. So collaborative capacity building is what is supported through our technical assistance grants. We don't support collaborative capacity building just for collaboratives that are convening and trying to coordinate their work. That collaborative has to be working to achieve a systems change. Again, that upstream approach. So that is a big clarifier with our technical assistance grants. You'll see that all of our grants have the same 5 criteria. So you'll see them listed here. It has to be in a collaborative to achieve a health outcome with a systems change framework and a health equity lens and a budget that is consistent with the proposed scope of work. So for the technical assistance grants, those are for collaboratives that are at their beginning journey towards systems change, right? So this is the beginning of the systems change continuum as we refer to it. So as you're thinking, you are one organization in Arizona, a registered nonprofit or fiscally sponsored organization that is hoping to bring people together to work towards systems change. This would be the grant for you, the technical assistance grant. So you're hoping to form up your collaborative, or even if you have identified some of your core partners, you just need kind of to build up the infrastructure and address some capacity building needs that are needed to administer and function for a strong collaborative to work towards systems change. This technical assistance grant is where you're at. So the collaborative is at the very beginning stages of forming and building. This is the collaborative criteria. You still have to be, we are a health foundation, you have to be working to improve a specific health outcome. Of course, we see alignment within the will, the elements of a healthy community will visual. So you could be working in a specific or multiple aspects of that will to improve a health outcome. You don't have to be too specific at this point. Remember, you're at the beginning journey towards your systems change with the health outcome, but you have to be working to improve health here in Arizona. You also have to have a system change framework. Again, we don't support collaborative capacity building just for collaboration's sake. That collaboration has to be working to advance some sort of systems change. But again, you're at the beginning stage of your journey, so you don't have to know your specific interventions or solutions towards systems change. You just have to know that you're taking a systems frame, a systems thinking frame. You're hoping to make a change within a specific a certain system. You at least have to know what system you're hoping to change. But again, you're at your beginning stages, so that work will continue to evolve and strategies evolve as your collaboration builds. The health equity lens is really important and is reflected in a lot of aspects of the other criteria. So for instance, in your collaboration, as you're building up your collaborative, you should be engaging those community members with lived experience. We often say those closest to the problem should be closest to the solution. And that's a really important aspect of collaborative capacity building. So that's something, one way in which you can hold a health equity lens. The other way is through the health outcome criteria. And this is by utilizing disaggregated data to identify the specific populations or communities that are facing the greatest health disparity in that particular health outcome that you're trying to tackle. So for instance, if you're hoping to improve the diabetes rates in Arizona, that's great, but it's even stronger in holding a health equity lens if you've identified through data that the communities and populations that experience the greatest diabetes rates in Arizona are like the Black and African American communities. So your efforts are specifically focused on that with and for that population. So that's how you can hold a health equity lens in the work. And then for the technical assistance grants, the budget is up to 1 year, up to $20,000. I say up to because the technical assistance grant is to support a specific capacity building need for your collaboration. And that to address that specific need might take less than a year, and it might require smaller amount of resources rather than the maximum $20,000. So for instance, a technical assistance grant can be leveraged to support a consultant or facilitator to help your collaborative build up the capacity around a specific need that you have, say around a communication structure or building trust and relationships. identifying the partners and bringing them to the table, that would really help you advance your systems change. So oftentimes the technical assistance grants can help cover the compensation of a consultant here in Arizona that can address your specific capacity building need. And again, if that capacity building need is smaller in nature, then it might be a shorter time frame and a shorter amount of resources needed. And you would work with that consultant to develop a scope of work that includes key deliverables, an anticipated timeline, and whatever the compensation would be for that consultant that can then be covered through the technical assistance grants. You can work with a consultant that you might have a strong relationship with and that you know can meet your specific capacity building need. But if you don't have a consultant in mind, this is where that discovery conversation can help identify maybe a curated list of consultants and coaches that we know that can help address your specific capacity building need. And in this instance, we play a little bit of a matchmaker, so we can pull the resumes or CVs or the LinkedIn profiles or the websites that they have and allow you to choose who would be the best fit. If it's a broad enough scope of work that I think more than just a handful of consultants that we know might qualify for that opportunity, we can send out on your behalf a call to consultants. So we'll send a blast email to this team of consultants and coaches that we've convened to say, hey, Vitalyst is exploring partnership with XYZ collaboration that is hoping to tackle this specific systems change effort, if and address this specific capacity building need that they have for their collaboration. If you are aligned and feel you can take on this contract opportunity, send me an email back and I'll compile that list. And once we pass the deadline for folks to submit their interest, then I send you as a partner that list and again play a bit of a matchmaker. So you can conduct interviews, do your own research, and determine the best fit for that consultant. So this is how, again, the technical assistance grant can be leveraged to address your specific capacity building needs for your collaboration. If you're interested in exploring the technical assistance grant, again, go through the discovery intake process. So visit vitalysthealth.org, complete that discovery intake form, and then once we receive it, we'll review it and determine the alignment. And if there is, you'll be prompted to schedule a time to chat with one of the 4 Vitalyst directors. As you saw previously, we use a mechanism called Calendly to schedule. This is a 30-minute virtual conversation, very introductory for us to review your discovery intake form and have a conversation with you to discover partnership, learn more about your entity, learn more about your collaboration, learn more about your system change effort, what you're thinking about doing, and from there determine if there is alignment. If there is alignment, the director will ask you to draft a proposal. In this instance, it's a 2-page proposal, and you would reflect on those 5 grant criteria and how your project and your effort fits within each of those criteria. You'll submit that draft proposal to the partner. They'll provide feedback and maybe ask you to strengthen this area. They work to determine if there is alignment, and if there is alignment and once that proposal gets to a strong point, they'll invite you to submit that application formally through our online grants management system called Akoya Go. Once that is submitted, we go through an internal review process and reach consensus as a team on whether to fund or not. Or sometimes we might have some follow-up questions, in which case that director will follow up with you and perhaps work to revise your proposal and then resubmit it for our team to review and again reach consensus on whether to fund or not. Because these funds are up to $20,000, they do not have to be approved by our board. We set up our internal review process. So as you go through the discovery process, we review those and on an ongoing basis throughout our fiscal year. Our fiscal year goes from July 1 to June 30th. So we're coming across the end here, but our discovery process will remain open as we transition into our new fiscal year. So as you're seeing alignment as we go through this webinar and have a deeper conversation, you can still go to vitalysthealth.org, fill out that discovery intake form, and then we'll review that, and you may be prompted to schedule a time for us to chat through that discovery intake process. Let's see here. We have a couple of folks in the waiting room, so let's make sure they are invited. Perfect. Awesome. So we review those on an ongoing basis throughout the fiscal year. So there is no grant deadline. And then once we have our team meeting to reach consensus on whether to fund or not, the director will circle back with you, let you know, yay, you got it. And we'll write up the grant letter, send it to you for signatures, and there's usually a 2 or 3 week turnaround. So it happens pretty quick throughout the fiscal year. All righty. So once you have received the technical assistance grants, you've built up the capacity of your collaboration to tackle systems change, you move over to the Spark grant tier of our grants program. Again, this is the second tier of our 3-tier grants program. This Spark grant is meant, again, for that collaboration that has built their capacity. Now they're ready to plan their systems change. So you can consider this a planning grant. You'll see here the same 5 grant criteria, but you're advancing further along the journey towards systems change. So in this point, your collaboration should be a bit more formed up. Maybe it's not completely perfect. You still need to address some capacity building needs, or you might still need to invite more partners to your table. But at this point, you'll see we require at least 2 partners, ideally 3. We're really looking for quality over quantity. We really are looking that you are having the right people at the table that will help you advance your systems change effort. So your collaboration is a little bit further along the way. Your health outcomes should also be a little bit more specific, really framed using the will and being a bit more specific with, again, that disaggregated data, again, tying in the health equity lens. Also, that health equity lens connecting back to the collaboration piece, really and intentionally and authentically engaging those community members with lived experiences. Of course, we are still working towards systems change, so you're a little bit further along in your journey to that along the system change continuum. So from the beginning, you should have identified your system you're hoping to change. Now you're beginning to, through the Spark grant, identify and plan towards the specific interventions or solutions towards systems change. So you're a little bit further along in your journey on that systems change. So should be getting a little bit more meat to that bone. And then here the budget is the Spark grant is a 1-year grant of $25,000. This is again meant to be a planning grant, so that scope of work should be consistent with those deliverables. Very similarly to the technical assistance grant, to determine alignment with the Spark grant, you would complete the discovery intake form. Again, go to vitalysthealth.org, the partnering with Vitalyst webpage, complete the discovery form, we'll receive it and review it, and if aligned, you'll be prompted to schedule a chat with a Vitalyst director. Again, they'll have a conversation to learn more about your effort, how it might be aligned as a planning in the planning phase with the Spark grant, and then work with you they will have you work to draft your 2-page proposal. Again, heading the 5 grant criteria, receive that, provide feedback, determine alignment, and work to strengthen, provide feedback for you to strengthen the proposal. And then once it's in a strong position, we'll invite you to submit that proposal through our online grants management system, again, called Akoya Go. These grants do have to be approved by our board, so we run essentially on a quarterly review process. The deadlines for this past fiscal year have passed. However, we're starting a new fiscal year. So if you're seeing alignment with the Spark grant, still go through the discovery intake process, and we'll just queue you up for the next fiscal year. So we can still have conversations throughout the summer if you're seeing alignment with the Spark grant. And then we're still finalizing our timeline. So we'll have a fall deadline, a winter deadline in the new year. So it'll be quarter two and then quarter three and quarter four. So the fall, winter, and spring. So Q2 of 2026, Q3 2027, and then in the spring, Q4 of 2027. So crazy to say 2027 already. So uh, don't feel just because the deadlines are passed for this fiscal year that you still can't access a Spark grant because we will have a new fiscal year and a new budget for that. Last but not least, the third tier of our grants program, our systems change grants. So you have built up the capacity of your collaboration. You've done your planning. Now you're ready to go. You're ready to implement your systems change. That is what the systems change grant is for. You can see this as an implementation grant, right? There was a capacity building grant, there was a planning grant. Now it's the implementation grant. So this is the systems change grant. Again, you'll see the same five grant criteria here, the systems change, the collaboration, the health outcomes, the health equity lens, and the budget. But you'll see here, there's a lot more meat on these bones because you're far along in your journey towards the systems change, right? You are ready to implement, okay? So at this point, your systems change solution, your intervention, you've done that planning, you're ready to implement it. So what is the exact project design you're hoping to leverage support for? Similarly, your collaboration should be strong. You are ready to implement it, implement your strategies. You have the right people at your table and the right roles. Everyone knows exactly what you're working towards. They're singing the same song. Your collaboration is really strong. For the systems change grant criteria of collaboration, that collaboration is so strong that one of the things you'll submit with your proposal are letters of commitment from each of your core partners outlining their specific role, how they're engaging in your collaboration, how they're helping you advance towards systems change. So there's a letter of commitment to be submitted from your core partners as an assessment of your collaborative. You still have to be working to improve a health outcome, again, framed as an element of a healthy community, the will again, and again, getting more specific about which populations, which communities you're hoping to improve the health community of. And again, holding a health equity lens, both in the health outcomes and in the collaboration, using disaggregated data, focusing on specific populations and communities, and ensuring that those populations and communities are engaged in your collaboration and working with you to advance and improve their health. And then for this, the budget, again, consistent with the proposed scope of work. In this instance, the system change grant is a 3-year grant of $175,000 total to help you implement your systems change. These do have to be approved by our board as well. So we have an annual grant process for our systems change grants. So we have this is an annual once a year grant opportunity. We're closing out our fiscal year, so the deadline passed. It was in the fall, but again, as we go into a new fiscal year, we will be reopening the grant cycles for our systems change grant, and the deadline will be likely in late September or early October. So you can have the fall time frame for that grant deadline. But we can still have conversations throughout the summer leading up to that deadline. So again, you would go to vitalysthealth.org, complete that discovery intake form. We'll receive it. You can have a conversation with a Vitalyst director to determine the alignment with the system change grant criteria. You could begin working on your proposal. It's a 5-page grant proposal. There will be a budget spreadsheet. We provide a template to provide so you can outline what expenses you have over the 3 years. What is the total anticipated cost of your system change grant effort, even beyond the $175,000 through this grant? And then you would submit that by deadline. While we have our discovery intake process to discover partnerships, including alignment with systems change grant, we don't require the discovery process to be completed for the systems change grant. You can submit your proposal without having that conversation. However, we highly encourage setting up a discovery intake call for exploring the system change grant because it only helps determine a strong alignment, and if aligned, the Vitalyst director can review a draft proposal to ensure that you're submitting the strongest proposal as possible. So while you can just submit a proposal, once we open up our grant portal in the fall, we highly encourage you completing the discovery intake process to really determine alignment and help you strengthen your proposal and submit it by deadline. Once you submit your written application, we receive those. We have the joy of reading all of those. And then those that meet the minimum qualifications, again, those 5 grant criteria pieces, we advance to our whole team for review. And then we select, we have an evaluation rubric that is public. It's an open book test, so you know exactly the questions our grant reviewers are assessing as we do those reviews. We recommend a semi-finalist to and invite them to present their proposal in a second stage of our process. So you submit a written application, you might be invited as a semi-finalist to present, and that's the second stage of our process there. You'll see we have a window of time for your collaboration to present your proposal in a 30-minute virtual session. We do this as a mechanism to practice equitable grant making. So we work with a lot of grassroots community-based organizations that may not have a full-time fundraiser or a grant writer. So the written application might not be as strong, certainly strong enough to be invited to present, but they really do tell their story well, right? They can sell, they know what they're doing, they've been in community, they just can tell their story really well. So that's why we set up the presentation phase and have a separate evaluation rubric for the presentation. So we review the written application, we review the presentation, we merge that data, and then staff meets to recommend who we ultimately are recommending to our board to fund. You'll see if you go to vitalysthealth.org, we just announced our new class of system change grant partners for this fiscal year. So to get a sense of what we've supported in the past, you could go to the vitalysthealth.org grant page and see who are the new 4 grant partners we are supporting this year for the next 3 years. And you also can look back and to see what other grants we've leveraged for decades, not decades, for years past. We have them all archived there, so you can check that out. Again, this is an annual grant process that will open up in the fall. So as I mentioned, each of those 3 grant types have the same grant criteria, right? You have to be a collaboration, working to improve a health outcome, holding a systems change framework and a health equity lens, and the budget has to be consistent with the proposed scope of work. The biggest criteria that is often misaligned or a miss in any of those proposals is the systems change grant criteria. What the heck is systems change, right? As I mentioned, we take an upstream mechanism to improving health that really is tackling root causes, and that is often done through systems change, okay? So we frame systems change using this visual that we've developed with our friends at FSG. If you go to vitalysthealth.org, there's a whole webpage where we have a myriad of resources, including a white paper or a Spark report, as we call it, on systems change and taking a deeper dive into these 6 conditions of systems change. We have webinars, we have a podcast, we have other websites and papers and resources that can help you better understand systems change and see if your effort is a systems approach. But this is an easy visual that we often turn to that help folks better understand the different conditions that impact a systems change potential. The most transformative type of systems change is when all 6 conditions are met. However, we know systems change is hard work. It takes a village. It takes a lot of resource. It takes a lot of time, even longer than the total grant period of Vitalyst, even bigger than what grant support we can leverage through our Vitalyst grant types. So you don't have to tackle all 6 at the same time. You might simply be focusing on the policy condition change of systems change. And that's okay if that's where you're hoping to impact, or maybe a practice change or the resource flow change. These are the easiest conditions of systems change to see, right? If you're trying to change a policy, that's say voting yes on House Bill 1 or something like that, or implementing a practice change in that system or in that institution to change a practice, maybe more behind the scenes regulation or rulemaking, or maybe something at at an agency level or a city department. So a practice change. It's when you begin to get to these lower levels, these lower tiers, where these conditions are a bit more difficult to see and a bit more difficult to define. It doesn't mean that you can't work in this space, because we know certainly that we have to change power dynamics. We have to build greater relationships and connections. And of course, the most transformative condition of systems change is a mental model change, changing hearts and minds. So that is also a key condition of systems change. So you might focus on one or two of those areas, but it is important for you, and this is why it's so important to have these discovery calls to really frame your effort as systems change and help us better understand it and define it as strongly as you can in your proposal, because these are areas that are more difficult to see, better, more difficult and to define in your proposal. And that makes the review of the proposal that much more difficult and unlikely and more difficult for us to see alignment within that system change criteria. So it really is helpful to have those initial conversations through discovery. So if you go to, again, vitalysthealth.org, we have a whole web page that takes a deeper dive into what specifically these conditions include, and additional other resources that you can to engage in. And that brings us to the end. So that gives you a couple of perspectives into our into Vitalyst Health Foundation, how we operate through fiscal sponsorship and our TAP-AZ program, through our programmatic priority areas of housing, healthcare, and civic health, and then our grant-making side of the house that supports collaborative capacity building, planning, and implementation towards systems change. A couple of things I'll mention just from the get-go again. Even though we have priority areas in healthcare, housing, and civic health, that doesn't mean those are the only three areas that we support. Through our grant-making side of the house, we can explore partnership with anybody who's working within that the elements of a healthy community will, working to improve health. So you don't have to just be working in those three areas. You could be working to improve any health condition in Arizona. We have an open door policy through that discovery intake form. So just go to vitalysthealth.org to complete that. With that, Erica, were there any initial questions in the chat room that we can read and then address live for the recording?
There are no questions in the chat room, so I think we can open it up to just the live Q&A.
Sounds good. As folks do have questions, feel free to continue or to put them in the chat room if you'd like, or you can raise your hand and unmute yourself to ask live here. If you do have any specific questions about if your organization or entity qualifies or is aligned with Vitalyst and our grants, any of our grants, I ask that you just go to vitalysthealth.org and complete a discovery form, and then we'll begin to address those more specific questions. But if you have any broad questions, happy to answer them in this live Q&A. Thanks for the thumbs up, Kathy. And I see a hand raised. Andrew, how are you, my friend?
I'm all right, thank you. How are you?
Awesome. Happy Friday.
Yeah, likewise. Thanks so much for this. This is really informative and very exciting. I learned a lot. I have a question about the first technical assistance
Yes, sir.
type grant. So one of the things you were saying was it's important to have a collaboration and like find that collaboration with the people that are kind of most affected by an issue.
Mm-hmm.
But then you also said something about if you don't have those relationships, you could also try and identify a specific group that's most in need.
Yep.
And I'm curious, for that grant, if we don't already have that data around which groups are most affected, could that 20,000 or whatever amount we apply for be used to actually collect data and identify which group which we think is most in need of kind of support and collaboration?
Yes, absolutely. So for the technical assistance grant, the collaborative criteria at this point can be just one entity, the lead applicant who is hoping maybe to serve as the kind of the anchor of the backbone of that collaborative, and then bring those convening partners together. But first, leveraging the technical assistance grants to look at that data to maybe hire a facilitator, consultant, or coach that can walk you through kind of a systems mapping to determine who in the system is which partners in the system touches, and who are those partners that will really help you drive your systems change. So, for instance, if you're hoping to, what is kind of the sector that you work in, Andrew?
Well, I'm actually at ASU and I'm in the design school, and I've been trying to collaborate with people in urban planning, and we're really interested in how to bring youth into urban planning processes because they're
Ooh, fun.
heavy users of transportation systems but don't have a lot of say in them.
Cool. So, like, if you're in the transportation system, right, you probably want to engage, I know, entities that are part of youth serving organizations, right? And that would be part of a systems mapping approach that, say, a consultant might help you facilitate. And that the technical assistance grant can help cover the compensation of that consultant, the convening to do that systems mapping and whatnot. And then once you identify those partners, the actual convenings of those partners and like paying for food or the facilitation of that meeting, the materials, whatever is needed for that meeting, and then maybe the outcomes, the outputs of that convening, like a report or a systems map or something like that. Maybe role clarifications, job descriptions for those roles. So how is that partner engaging in your collaborative? Maybe establishment of memorandums of understanding or MOUs, especially as you progress along the systems change continuum. There might be our grants can be subgranted to cover to respect people's time and commitment to your collaboration. So your core partners can receive honorariums or stipends as part of the participating in the collaboration. Especially if you're working with youth, you want them to be at your table, providing them with maybe bus passes or transportation costs, reimbursing them for that, or honorariums and stipends as well. We often see, especially to ensure that those community members with lived experiences are part of that. So yes, those are some aspects that the technical assistance grant can cover.
Wonderful. Thank you so much.
Yeah, thanks for all your work. Any other questions? One thing also I'll note with our grant, while we have the three tiers, the technical assistance grant, the Spark grant, and the systems change grant, you don't have to start from square one. If you're ready to plan, you could jump to the Spark grant. Or if you're ready to implement, you could jump to the systems change grant, right? So you don't have to start at the technical assistance grants. If you've already built up your capacity, if you've already done your planning, you could simply apply for the systems change grant. Awesome, Nadrea. I'm glad that was your question. I'm reading your mind. Michelle, brilliant. Yes. You don't have to start from square one. You can jump to the Spark grant or to the systems change grant if that's where you're aligned. Again, that's where the discovery intake call is also really important, because you might think we're ready to plan, but as we have that conversation, you're just like, you still need to do a little bit more work to strengthen your collaborative before you get to that point. Any other questions? We're coming up to the top of the hour. Of course, as what happens with me often, as soon as you log off of a webinar, you're like, oh, I had a question. We have an open door policy. So if you have a question, reach out to us. Go to the discovery intake form at vitalysthealth.org. You will receive a follow-up email with a lot of the resources that we covered today, the slide deck, this recording, and the link to the discovery intake form if you do see alignment with Vitalyst. Thank you so much for all of your time today, especially on a Friday before a Memorial 3-day weekend. Thank you all as we remember those who have served our country and as we kick off our summer. We hope you all have a very healthy weekend and a very safe weekend. Thank you so much for your engagement today. Take care.